Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Ghayda.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Welcome to the Egg Whisperer Show. You guys, you know you hear me say this all the time. It's always nice to have sperm on ice. Well, I have someone who's made it his career, and he might be wearing a shirt that says that right now. I'm kidding, but he should. And I'm so excited to have Dr. Ramy Ghayda to talk to us about sperm, and more about sperm. Welcome, Ramy. Thank you for joining us today.
Thank you so much. Thank you for having me today, Amy.
Well, I want to tell our listeners about you. You're an experienced urologist who has a long history of working in the higher education industry. Your specialties include urology, andrology, and near and dear to my heart, male infertility. And you're currently an assistant professor at University Hospitals in Cleveland, Ohio, and the chief medical officer at Legacy, a company that is truly revolutionizing how men and couples store and freeze sperm. And I'm so glad you're here to talk to me today about sperm. We'll talk about declining fertility rates and why it's important to test and freeze your or your partner's sperm. Welcome to the show once again.
Thank you.
Tell us about Legacy. You're chief medical officer of this company. What does it do and how did it come about?
So Legacy is a digital fertility clinic, right? You know, traditionally, all these fertility clinics don't have and are not designed to attend to any men's needs or men's journey, right? They would always focusing on the female part, and the man was like a small part of the journey for the whole fertility in the couple, right? So Legacy was here and was created to fill this gap, right? So Legacy would be with the journey of the clients all along, from an emotional perspective, medical perspective, nutrition perspective, psychological perspective. So we look at fertility as a journey, and then we're there to support all of the aspects of this journey. So first it started off by providing analysis and the ability to freeze any pile of sperm that's needed. And then we branch out to provide free telehealth services. Now we have the supplements like CoQ10 and multivitamin supplements. We have DNA fragmentation tests, we are the only at-home kit that provide the service. Yeah, I know it was like a very big deal to have it, because DNA fragmentation would tell you is a very good indicator for the integrity of sperm DNA. So once you have a high DNA fragmentation index, it might mean that you have some problem that can be corrected and then improve male fertility. So we can test for that.
And can you do it all at once? Can you do the semen analysis and the DNA frag off one sample, or do they have to collect more than one sample to do this?
The analysis, freezing, DNA fragmentation with the same one sample.
You guys, this is a dream come true for me, because you know the S of the Tushy method is sperm, and then I got the balls method. I don't know, Ramy, if you knew about my balls method, but I have the balls
I've heard
method.
about it.
Yeah, and so the B for the balls, after you go through the S of the Tushy, is background genetics, and getting your sperm DNA fragmentation test done is something that's really important to me. I feel like it definitely does make a difference to make sure that the sperm is as sparkly as possible before you make an embryo or make a baby. So this is so nice that you guys have been able to do this for my patients. So thank you.
You're welcome. And I think we've had also partnered with many other companies. Like now we have our own Navy SEAL, the US Navy SEAL. So they use our services. Now our services is included and covered by many insurances in New York. So we're even thinking about the financial aspect of fertility and trying to support men, couple, or anyone interested in parenthood to make it as easy as possible and facilitate the whole process.
So you talked to us about the products and services that you offer. That's outstanding. Supplements, semen testing, sperm freezing, DNA fragmentation. Can you find my eggs?
Nutrition support, emotional support, free telehealth, one-stop shop for fertility.
I love it. And I kind of feel like we should now be able to, maybe join forces and do sperm freezing parties, because I got the egg freezing parties. I got a lot of single ladies that are freezing their eggs waiting for Mr. Right. And then maybe you have sperm freezers who are also looking for someone who's frozen their eggs. Don't you think there might be some sort of collaboration there?
I agree 100%. This is an ongoing conversation. I mean, we're trying to break the taboos around male fertility and then parenthood. This is like we need to be proactive about it. We need to have strong partnership and then reach out to people, explain to them, educate them, and then try to facilitate the journey.
Love it. So tell us about yourself. Like, what made you go into male fertility? Why are you so passionate about what you do?
So, after urology residency, you have to choose between different subspecialty, right? You have oncology, pediatrics, and urology. And I tell you with all subjectivity and bias, like male fertility is the best, right? I mean, being there with your patient, trying to improve their quality of life, trying to facilitate them having their own biological kid is priceless, right? The reward you have just by interacting with them, just by being part of their journey, is undescribable. I mean, I'm sure you know this feeling. You always talk about the spark of the sperm. I think there's always a spark between the physician and the patient and the couple when you're there for them, help them, listen to them, be compassionate. I mean, and this goes well with my personality. This is the thing I want to do. And I think it builds a lifelong relationship with your patients, right? It's not like a one-time deal and then they're gone. It's like they're always there, you're always part of their life. They always send you pictures of their kids. It's very rewarding.
It is. There really isn't a word in the English language that can describe it. I can't find one. But conceivably, it's the most rewarding job, and I use that word on purpose.
And then the other good part of male fertility, it's such a field that's new, right? We only know 50% of what's happening. Like the other 50% is just a black box, just waiting for us to be discovered. Like so, you have research, you have technology, you have new genomics, you have proteinomics. It's a field that you have so much potential to be discovered and advanced, and I want to be there when all of things unravel themselves, right?
So one of my, I don't know if you know this about me. I really like April Fool's jokes, and I kind of create the joke in a way that it makes people think that it's real, because I really actually want it to be real. So last year I went to space and I did the first IVF cycle as part of my April Fool's joke. And this year I'll just break it to everyone what I want to do. But Ramy, do you think this is possible? Like, I want to maybe put a little tracker on a sperm cell and then have some sort of like robot arm where I can like show it where to go and like take it to the fallopian tube and then insert it into the egg somehow. I mean, I know I can't do that without stripping the egg or removing the tumor cells.
I mean, probably not in 2021, but this could really happen like a couple of years down the line. I mean, the advancement in the field, the research, the technology is so great. It's like going at a rocket science speed, right? So I think in a couple of years we're going to discover more, we're going to learn more, and the more we learn, the more questions we have. And this is the beauty of male fertility and fertility in general, right? It's always a field where you have so many questions and so many answers, and when you answer one layer of this complexity, you have many more layers to be passionate about.
Yeah. And obviously you're passionate about educating people about sperm and freezing their sperm, but obviously there's a reason why we're talking about this, because of declining fertility rates, especially in men. So tell us a little bit about that and why you think we're seeing this decline.
Over the past decades, we have a good level of evidence and supporting data saying that there is an actual decline in male fertility, right? We know that the semen parameters, sperm concentration, volume, motility, so the quality and the quantity of the sperm are not as good as they were 50 years ago. And we have many landmark studies by Dr. Swan, by many other very famous researchers saying that we are seeing almost a 50% decline in semen concentration, right? Even though these studies have some backlash because of their design, because they only included like developed countries, because of the different technique of counting sperm at the lab from a technical perspective, but still we know that this is real, and I believe that this is real. We don't know the extent of it, right? We don't know if it's like 50% more or less, but there is a trend there that's going downward, right? So it's a very complex question to answer, right? It has many factors. So first of all, we have more chronic diseases like diabetes, obesity, hypertension. People are taking more medication. They're living a poorer lifestyle, right? Like the overall health of society is not as good as it was before. So this is one area. The second possible explanation is environmental factors. So in 2021, with everything around us, we're exposed and bombarded by so many chemicals. Like every day we wake up, we eat, we interact, we breathe, we touch. Everything around us is made of chemicals, right? So these chemicals, they might disrupt the endocrine system. So it's called endocrine disrupting chemicals. And these EDC that we call them will affect fertility. So they will go to either the brain to mess up with the level of the hormone or the testicle where they can interact and then provide like a suboptimal semen production. So it's a good thing that we know about this trend. It's a good thing that we can identify some factors, but we are like very in the beginning of this chapter of declining male fertility, and I think we need years and years before we understand exactly what's causing this decline. But for now, people should be aware about their lifestyle, about anything that might cause a decline in their fertility. So we know that smoking, excessive alcohol consumption, marijuana, any recreational drug are negatively correlated with sperm production, right? We know that anything that would increase the temperature of the testicles is also negatively correlated with sperm production and quality. So the testicle, they sit outside of the body for a specific reason, because they don't want the internal body temperature, right? So hot tubs, jacuzzi, saunas, very tight underwear, if you keep your laptop on your laps for extended period of time, all of these factors will increase the temperature of the testicles and will negatively impact sperm production. And finally, the third bucket that I think about is anything that's healthy for you, for your body, for your well-being is good for sperm production, right? So if you eat healthy, a lot of green stuff, no added sugar, no processed food, no trans fat, if you exercise a couple of times per week, if you sleep around 7 hours per night, if you're not very stressed, all of these factors will be good for sperm production. And now this is like a very interesting point, because now we know that fertility is an indicator for overall health, right? So they're talking about fertility as being the 6 vital signs. So we have a heart rate, blood pressure, what have you. And then fertility is number 6, because studies are showing that infertile men in their 30s and 40s had a higher risk of developing diabetes, hypertension, hospital admission. They were at a high risk of dying, like 2.5 times more risk of dying at an older age. So really, fertility is not just a one-time disease, right? It's just a continuum of condition that might affect survival, outcome, and quality of life.
Before we started the interview, you mentioned that you deal a lot with the emotional side of male infertility and offered to share about rebalancing the conversation and workload from women. Can you tell me more about what that means?
As you know, like, and you experience it every day, infertility is an emotional roller coaster, right? Like you have your ups, your down, you have the expectations, you have the pressure from your family, from society, from like every aspect of your life is just focused on this one specific ability to conceive or not, right? And traditionally, because we live in a very sexist society, let's admit it, right? I mean, we're trying to advance and improve, but still it's a very sexist society. We have a lot of toxic masculinities. We have a lot of misconceptions linking, for example, fertility to masculinity and fertility, like virility, to sexual performance. Like people and men would think like if we're not fertile, then we can't perform and we're like have some sexual problem, which is not true. So all of these factors are really having it all on the woman, because they traditionally were the one to blame for the infertility problem, right? We know now that infertility is a very common condition. Like 15 to 18% of people in the society would suffer from a form or another of infertility. And we know around 50% of the factor for this infertility is responsible by men. So 20% by the male factor alone and 30% by a combined female and male factor. So really, men are half of the equation. Like we cannot just take her out. You cannot just blame it on the woman, even though we're used to do so. And then it's easy for us to say, yeah, it's not our problem. Let's just go to your reproductive endocrinologist. I'm sure there is a problem in there. We should change this narrative. We should like break these taboos and judgment and prejudice. And it's the responsibility of the physician, the provider, and the healthcare to reach out, educate, doing these type of podcasts, working at places that Legacy, right, to try to facilitate the discussion and try to really be there and understand.
So what can men do to participate in this rebalancing that you talk about so well?
They have a duty to have an open mind, right? They need to understand the facts and the science, that they are part of the equation, they are part of the problem, and they can be part of the solution, right? They need to be involved and they need to be proactive about their health and then the sanity of the relationship, right? It's not the blaming game is not appropriate with fertility, right? They can do it elsewhere, but for fertility, you need to be supportive, understanding, and you need to like understand that this could be a problem just caused by you, right? It's like I have so many patients with only male factor, like the female is perfectly fine, no obstruction, everything's working, but there's a problem with the male part. And the good news is that more than 50% of the cases, we can find a solution and we can help. And this is like a very good thing. And then they should not lose interest in the whole journey, right? They should not just try to repress it as we do, like so many emotions and duties, right? We should stand up to it, own it, and then be there to our partner. And now, and here we're not talking only about the heterosexual couples, right? Like any couple who are interested in fertility, like gay couple, transgender community, non-binary. So anyone who's interested in parenthood, they will have their own journey, right? And then men and individuals should be there and should understand that they need to be part of the discussion, of the medical therapy, and they need to be part of the solution.
Because if they aren't, I can tell you, if you're, let's say, in a even if, like you said, no matter what type of relationship you're in, your partner might get a little bitter. And the bitterness will turn into resentment. And I always tell my patients, get better, not bitter. And I tell the male patients, the 3 questions you need to ask your partner are, what can I do for you? How can I help you? What do you need? And she's always right. Ramy, is there anything else you want to add before we end today's interview?
So I just want to talk a bit about Legacy as a company. We're a startup. It's a digital fertility clinic based out of Boston, but now we're covering most of the US. So Legacy was founded and created just to fill the gap in the male fertility space, right? We know that there is a mismatch between the resources of fertility between the male and female. And we know that most traditional clinics, whether private or academic, didn't have in mind the needs and the emotional journeys of men in this process, right? I can tell you, going to an andrology lab, providing a semen sample is one of the most horrific experience a man can go through, right? They have this very dark room with a porn magazine from 1995, and then people are just going above the door. Sometimes they're knocking on the door. You have someone before you that was in this room. Someone is waiting to go to this room and provide sample after you. So having a service where you can provide a sample at home is priceless for men, right? So Legacy is there just to support in this perspective. So you'll provide the sample, you mail it to one of our labs, and then Legacy can provide analysis, freezing, DNA fragmentation. And then they have a lot of products like nutrition support, vitamins, CoQ10, free telehealth consultation. And now so many clients in New York have the option to do free services using their insurance. So we have partnership with insurance. We're covering most of the Navy SEAL in the US. So basically, we're covering everything that has to do from products and services with the fertility journey.
Well, thank you, Ramy, for coming on. I want people to just know where they can find you as well. Where can patients find you?
So I'm in Cleveland, if anyone is in Cleveland locally, and then on the website we have our blog, we have our guides. We focus a lot about education at Legacy. So on the website we have around 20 or 30 guides just about male fertility, fertility in general, conception, and then I'm gonna just share my email. If they have any questions, concern, they can find me there. I'll be always happy to support them, have a conversation with them. And then a client of Legacy can just book a free telehealth call with me or with an andrology trained nurse to have just a regular discussion and support, like a support telehealth consultation. And they can ask all their questions, voice their concern, and I'll be more than happy to help.
That's wonderful. Well, I'm so glad you guys offer this service to my patients. So thank you for all the hard work that you guys are doing to make sperm sparkle everywhere.
Thank you.
I think that is so wonderful and so important, and it's about time, don't you think?
I agree.
It's very exciting. Thank you for sharing all of this with us, and thank you for, dedicating your time and your passion and talking to patients out there from all over to tell them how to make their sperm sparkle.
It's my pleasure and passion.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Ramy Ghayda
And you have yet another success story.
Just launched by an East Bay fertility doctor.